truly think that we need to stop telling everyone whenever they're going through chemo and radiation, we need to, in the world of cancer, stop saying, no, it's not safe. We don't want to interfere with your chemotherapy. We don't want to interfere with your radiation, because it's not true. We got to open our eyes to the research that is out there instead of being very stuck in our little holes saying, no, it's not safe. We really want your chemotherapy, your radiation to work well, and the IV vitamin C is interfering with that. That's absolutely not the case. We need to look at you. We need to look at what's best for you. We need to look at the research and how you might be a part of those populations and figure out, is this actually truly going to impact your treatment in a positive or negative way? So sometimes you just have to push a little bit in order to get the approval to do your IV vitamin C if you're going through chemo or radiation. Welcome to the Flourish After Cancer Podcast. I am Dr. Megan Bernard. Today, I want to talk about IV vitamin C, and I'm also going to talk a little bit about oral vitamin C and what can it do. Like, basically, is it going to be beneficial for you whether you're in treatment now or have finished treatment? Kind of what are the pros, the cons, how does it work? All those kind of things is what I'm going to talk about today. So all about intravenous vitamin C, because really it is one of the most common functional therapies that have been studied. I would say IV vitamin C, there is quite a bit of research on it. And there's a lot of human research, which is what we're really looking for and quite often missing when it comes to natural products. But in the world of IV vitamin C, we've actually got some clinical studies, which is fantastic. I will link a couple of those into the show notes as well if you ever wanted to look into it a little bit further. I'm not going to quote them today because that's just boring and it takes forever to kind of put all those numbers exactly together. But I do have papers that we have gone through, we've researched or used for research, and that's how we kind of find validation behind when we prescribe certain things or not, whenever we recommend the IV vitamin C or not. So let's start with, what are the benefits of IV vitamin C? Let's start with benefits during treatment. So let's say you're still in chemotherapy. Some of the benefits of doing chemotherapy as well as IV vitamin C at the same time, or not delivered at the same time, but perhaps within the same week you're getting your chemotherapy, you want to have a vitamin C IV. But the benefits seen are that we can see people have better quality of life overall. So they have more energy, they have less brain fog, they have less pain, aches and pains, and they also experience less nausea a lot of the times too. So some of these side effects that you might be having from your chemotherapy, if they're really bad, something you might want to consider is having IV vitamin C. Or if you're in the initial diagnosis stage and you're just waiting to begin your chemotherapy, you might want to consider adding in IV vitamin C therapies alongside your conventional chemotherapy as well, because you might just feel better while you're going through chemotherapy. And we know that chemotherapy can have a lot of not so nice things happen. And if we can make sure that we're mitigating those as best as possible, because sometimes chemotherapy goes on for several months, right? You don't want to be feeling like crap for several months. If we can add in the IV vitamin C, perhaps you feel better. You don't have a lot of those side effects, or if you do, they're very much lessened. So we have human research showing that people who do IV vitamin C therapy alongside their conventional chemotherapy tend to have better outcomes in terms of how they feel, their quality of life. We also have some research done in comparing two groups, basically. So we got the group of people who do the chemotherapy, and then we have the other group of people who do the chemotherapy, but they also do the IV vitamin C, and they're looking at length of life. And quite often, these studies are done in a population with a terminal diagnosis or a more advanced or aggressive type of cancer. And what they're looking for is, does the IV vitamin C help these people to live longer? And we do see that in the results, the group that does the IV vitamin C alongside their chemotherapy, there are certain papers showing that they have 3 to 4 month increased length of life compared to the people who don't do the vitamin C. What I feel like is really missing is we need to do more of the IV vitamin C research, like these papers, in less aggressive types of cancer. And we do have some of it, to be honest. And the reason being is that potentially feeling better was actually what caused these people to live a little bit longer, not necessarily anti-cancer impacts, which I'll get into in a minute. That's just one thought. There's many thoughts that I could have. But overall, I would like to see more research if we're looking specifically at, does IV vitamin C help people to kill cancer, get rid of cancer, compared to just chemotherapy alone. I want to see more of the research in, more diagnoses of breast cancer, colorectal cancer, less aggressive types of cancer as well. I want to see that happen before I'm going around telling everyone, oh, you're going through chemotherapy. Well, if we really want to make sure that we're killing cancer cells even more, then we want to throw in the IV vitamin C as well alongside that. But mainly, if we're going to choose to advise someone to do IV vitamin C when they're in cancer treatment, it's going to be, you might want to consider taking the IV vitamin C or adding in the IV vitamin C, intravenous vitamin C, because it might help you to feel better throughout your treatment. So I'm not necessarily saying, and it might help you to get rid of the cancer better or quicker or whatever it might be. It's mostly for the quality of life impacts. And then when it comes to radiation, same thing. We do see people experience less of the side effects. So they have more energy, less skin issues, things like that, whenever they do the IV vitamin C alongside their radiation therapy. Now, the next question you might be thinking about, well, is it actually safe to do IV vitamin C during chemotherapy or IV vitamin C during radiation therapy? And the answer is most likely yes. We do have a lot of research papers showing that doing chemotherapy and IV vitamin C at the same time is safe. Now, there are some chemotherapies that it might not be safe with, but off the top of my head, I cannot think of them. I know there are some, but it's very rare. And it's very rare that someone comes to us on the chemotherapy when we would look it up kind of thing. And we're like, oh no, that's one of the ones that it's not safe to do IV vitamin C therapy with. So there is a lot of evidence showing that the IV vitamin C is safe alongside the majority of chemotherapies. It's not going to interfere with the way that chemotherapy is delivered. It's not going to lessen its impact. It can actually potentially improve the impact of the chemotherapy because we're lessening someone's side effects. We're helping them to feel better, which causes fewer delays in how they're receiving their proper chemotherapy care regimen. And same thing with radiation. I feel like we get a lot more pushback when it comes to radiation. And you know what? I'm going to explain it now and then I'm going to solidify it in just a little bit. But basically, radiation is a pro-oxidative therapy. It causes oxidation in order to kill cancer cells. That's what radiation does. And vitamin C, whenever we do it orally or at lower doses, is an antioxidant. And if we're going to have a pro-oxidant and an antioxidant, well, they fight each other, they neutralize each other, and they kind of work against one another. So the thought is that if someone's going through this pro-oxidative radiation therapy and then they're taking this antioxidant vitamin C, that they will interfere and that the vitamin C will cause the radiation to not work as well. But the thing is that when it comes to delivery of IV vitamin C for cancer, we're actually looking at very high doses by IV. We're looking at usually 50, 100, or 150 grams of vitamin C in an IV bag. And that actually is a pro-oxidative impact, which is different than a low dose of vitamin C, which is an antioxidative impact. So whenever we're delivering radiation, the pro-oxidative therapy with the high doses of IV vitamin C, they're actually going to be complementary. They're both going to be pro-oxidative. They're both going to cause the cancer cells to die. So they are safe as well. And we do have some papers on that. Although I would always love some more papers. It is hard to get research papers done on a lot of these natural therapies, but we consider it to be safe to advise our clients on a case-by-case basis to do the IV vitamin C alongside the radiation if they're looking to improve their quality of life and potentially have an anti-cancer impact, like cancer-killing impact on the cells as well. So again, we do have papers, they're out there showing the safety of chemotherapy and IV vitamin C and radiation and IV vitamin C. You typically just have to find the right functional oncologist. So you want to find a doctor who is experienced in both cancer as well as IV therapies when it comes to the IV vitamin C and holistic IV therapies. They will be better able to advise you on the safety and efficacy of the treatment on a case-by-case basis. But I used to run a clinic. We would do IVs all the time. I used to work in many clinics as well, like doing so many IVs, a lot of them vitamin C IVs, a lot of them for people who are currently in cancer treatment. And we did see improvements in how they were feeling and how they did. And I truly think that we need to stop telling everyone whenever they're going through chemo and radiation, we need to, in the world of cancer, stop saying, no, it's not safe. We don't want to interfere with your chemotherapy. We don't want to interfere with your radiation because it's not true. We got to open our eyes to the research that is out there instead of being very stuck in our little holes saying, no, it's not safe. We really want your chemotherapy, your radiation to work well, and the IV vitamin C is interfering with that. That's absolutely not the case. We need to look at you. We need to look at what's best for you. We need to look at the research and how you might be a part of those populations and figure out, is this actually truly going to impact your treatment in a positive or negative way? So sometimes you just might have to push a little bit in order to get the approval to do your IV vitamin C if you're going through chemo or radiation. Let's now talk about the benefits of IV vitamin C after treatment. So I have to say that we do recommend IV vitamin C sometimes. And the scenarios that might make us think of IV vitamin C a little bit more often for our clients are if they had potentially a more aggressive type of cancer diagnosis, like some ovarian cancers, or that's actually the one we recommend more often, or more advanced breast cancer, or pretty much any advanced cancer. We might recommend they consider adding in IV vitamin C alongside their whatever treatment they might be doing. If we're looking at recurrence risk, they might not be on an active treatment. Sometimes they are if it's a more aggressive treatment, but it might be something we can consider saying like, hey, like your treatment's done. We really want to continue the cancer killing anti-cancer impacts. There's not a lot of research on if this can reduce recurrence risk or not, but based on the mechanism of action, which I'll get into in just a minute, it might potentially have a cancer killing impact. Would this be something you'd be willing to add in with very little risk and potentially zero to maybe a lot of return? We just don't know. And then just had that conversation there to see, like, is it something you want to do? We also want to consider, are there other therapies that might be better? Like I actually truly prefer mistletoe therapy, which could be delivered. You can do it yourself, subcutaneous injections at home, or you can get IV mistletoe as well. So let's say for whatever reason, they couldn't get mistletoe therapy, but we're like, well, why don't we do IV vitamin C? And that worked for them. Whereas I would probably be like, can you do mistletoe or IV vitamin C? And they'd be like, I can do one. I'd be like, I want you to do the mistletoe then. 'Cause just my preference for the even more research around the mistletoe and the mechanism of action. And then there's also some additional studies on recurrence prevention as opposed to just people who are in treatment, whereas IV vitamin C is mostly studied on people who are in treatment. And I'm definitely going to be doing an episode on mistletoe, probably more around Christmas because it's a little bit Christmas themed. Um, but yeah, so we're going to look at, are there other therapies that might be more useful to you? Have we explained that there's not a lot of research around how it might reduce recurrence risk or not? Whenever you're post-treatment, we're looking at reducing recurrence risk. There's not really a lot of papers or evidence around that, but we do have some information on how it might work, and it might benefit you in other ways as well. If your immune counts are low, if you're really tired, if you're having trouble healing from surgery or something like that, then maybe vitamin C might be beneficial. And then what is everything else that you're doing? What is the aggressiveness of the cancer you were diagnosed with? If it's a lesser, it's not as aggressive, then maybe IV vitamin C might just be too much time, money, energy for you to do. We can do other things instead. So just to kind of take a well-rounded look at everything to see what is truly best for you, what else are you doing, what are other things that could give us some benefit. We're going to figure out if IV vitamin C is a good choice for you. But potentially, if you're looking at doing IV vitamin C post-treatment, some other benefits besides maybe killing cancer cells could be that it might lower inflammation. It might improve your tissue healing if you had surgery, might improve energy. Maybe if your white blood cell counts, maybe it'll improve that as well. Overall, it might make you feel better. So those are some things to consider if you're post-treatment and you're like, is IV vitamin C good for me? Let's now talk about the mechanism of action. And I want to talk a little bit about how oral, so taking vitamin C pills, is different than IV vitamin C, and then the difference in doses of vitamin C by IV too. So the mechanism of action behind intravenous vitamin C is that vitamin C in high doses, high concentrations, and typically this is looking like over 15 grams, so maybe like 20 and typically the dose, and whenever we're looking at supporting someone through a cancer diagnosis, the dose of IV vitamin C is like 50, 100, 150 grams of vitamin C in each bag of IV that you're being delivered. So in the higher doses, let's just say 20 grams and above, it's going to act like a pro-oxidant, not an antioxidant as it does at the lower doses. So as a pro-oxidant, it's going to cause this oxidative reaction, which is kind of like, I picture it like an explosion within the cancer cells that are going to be eating up the vitamin C. And it's going to eat the vitamin C and it's going to be like, oh, this is a lot of oxidation going on. It's going to kind of cause the cell to explode. going to cause a cancer cell to go through apoptosis and die. And whenever we're looking at how does this impact the normal healthy cells that you're also delivering vitamin C to, well, the normal healthy cells will eat up the vitamin C, but it's like, oh, that's a lot of vitamin C. I'm going to break some of this down and it's going to get rid of it so that it doesn't cause that explosion within the normal healthy cell. Whereas the cancer cells are not equipped with what it needs in order to break this stuff down. So to get a little bit more specific, the IV vitamin C generates hydrogen peroxide. Peroxide within these cancer cells usually gets broken down within normal cells, gets broken down with something called catalase. So peroxide, which gets generated from the IV vitamin C within normal cells, gets broken down by something called catalase. And then the hydrogen peroxide gets broken down. It's safe. The healthy cell is not going to be impacted by it. But in a cancer cell, the hydrogen peroxide gets made from the vitamin C that the cancer cells ate, but it doesn't have this catalase, so it can't break it down. So that's going to cause the hydrogen peroxide to build, causes explosion, and the cancer cell dies. So the difference is that your normal cells have something to break it down. The cancer cells don't have that thing to break it down. The cancer cells will die. The normal cells will not die. So that's how the anti-cancer impacts, the cancer-killing impacts of vitamin C are said to occur. But again, we need more research showing that the IV vitamin C can actually improve length of life and reduce recurrence risk and things like that to know if it's actually killing the cells in an effective enough way to tell everyone to take the vitamin C by IV, for example. I still think it's beneficial for sure, but I just want you to have the full picture of information in order to understand prioritization of your plan. Is it of a higher priority and higher impact to you? If not, let's move on to something else. So we talked about the high dose IV delivery, so 20 grams and above. Let's now talk about the low dose, which you may have come across there's a lot of like IV spas out there, I guess is what you could call them, IV bars, where you might go for like a vitamin drip or a Myers cocktail or something like that, where they're typically putting in some vitamin C into that bag. And the bag might have about 15 grams of vitamin C, so a lower dose of vitamin C. But it might also have like B vitamins in it, maybe some magnesium, anything like that, that are kind of good for general health. And hangovers, I think that's typically what they're marketed for, unfortunately. But yes, we want to consider that there's a difference between these vitamin bags and like a Myers cocktail bag compared to a higher dose vitamin C bag, which is typically made for someone looking for cancer or sometimes immune impacts, like people might have a high dose vitamin C for Lyme disease or other things. Honestly, my research is very much in cancer, so I can't even think of what the other high doses of vitamin C bags might be used for these days. But typically a low dose is more for general health, immune function. Maybe we recommend them sometimes for someone who's struggling with healing post-surgery because they need extra vitamins and minerals to help the tissues to heal. So that's where we recommend more of a low dose vitamin C. And then we got the high doses for anti-cancer killing impacts and then side effect management from treatment, things like that. So the lower dose, the 15 grams, is going to have more of an antioxidant impact. So it might go and protect some of your cells against DNA damage. Or generally, it's just for general health, immune function, things like that. So a big difference between the low dose, the high dose. And again, the high dose of pro-oxidative is different from the antioxidant. And that's why the pro-oxidant high dose is safe for radiation, where we're having two double pro-oxidative impacts because radiation is pro-oxidative as well. Whereas we would probably not consider and maybe push people away from doing a lower dose 15-gram vitamin C bag if they're in radiation, for example, because we'd have the antioxidant impact of the low dose vitamin C against the pro-oxidative impact of radiation. We don't want that difference to happen. And then the next thing is that you're thinking like, well, can I just take my supplement of vitamin C? Is that doing anything? Is that actually antioxidant? And if it is it having any sort of positive impact on keeping cancer from coming back? So the oral vitamin C delivery, so if you're taking vitamin C by pill form, you typically can only take about 2 to 3 grams of vitamin C at a time before it causes diarrhea. So it ends up acting like a laxative at a certain point where you have so much vitamin C in your body that your body's like, no, we're going to do something with this. I think it typically absorbs up a bunch of water and then gives you diarrhea. We don't want that. So to be honest, I have seen clients come to us And they have kind of improved their tolerance over time where they can take up to 5 grams or maybe even like a little bit more vitamin C at a time because they start it low and then they slowly increase their dose week by week, or even after every couple of weeks in order to get themselves up to 5 grams without having the diarrhea. I don't recommend it. I think it would be awful if you were out and about at work or if you were, I don't know, doing something and then all of a sudden you had to run to the bathroom because you overdosed on your vitamin C. We don't want to see that happen. And the other reason is because I've never recommended vitamin C supplements uh, for anyone, I think, unless we were looking at helping, just kind of giving it to someone who's like, I get colds a lot. Do you have anything that you can recommend to take just to get through it a little bit better? And then there is some research showing that vitamin C by supplements can potentially decrease the amount of time it takes to get over a cold or flu. But in terms of cancer, I cannot think of any absolutely beneficial impact of vitamin C at 2 or 3 grams, um, unless it's like added into like a wound healing supplement or something like that, because it can be helpful for wound healing. But it's one of those things that we typically get people to stop taking because it's just an added extra that we don't want them to take too many pills at once. It is not truly having the impact that we want it to have. There's other things that would be better, basically, instead of taking the supplement vitamin C, because it really doesn't have a cancer killing impact or many benefits outside of cold, flus, and wound repair at these lower doses that you're able to tolerate taking it orally. Whereas if you're doing an IV vitamin C, like an IV infusion, it is going to bypass the gut and it's not going to give you diarrhea. It just goes right into your bloodstream and it goes to the cells where it's needed, it gets metabolized, and then it gets eliminated from your system, typically through like the kidneys. So we typically don't recommend oral vitamin C, not because it's dangerous, just because we don't find it to be super effective. If we do want the researched effects that a lot of people hear about when it comes to vitamin C and cancer, it's got to be the IV delivery form because otherwise it's not going to have an impact on the cancer cells or what you need it to do for the body to be anti-cancer at these oral doses. We need the IV form. All right. So again, we just to kind of recap what we chatted about, most of the research is on IV vitamin C during cancer treatment and how it improves quality of life. And then in more aggressive types of cancer, it can potentially improve length of life by a couple of months whenever it's delivered alongside conventional therapy. We talked about the low dose and high dose of vitamin C, how low dose is antioxidants, about 15 grams, and then maybe above 15 grams or 20 grams is usually the pro-oxidative dose, the higher dose of vitamin C. And for cancer, we're looking at 50 to like 150 grams of vitamin C IVs by IV. We also talked about radiation and how the high dose is recommended, not the low dose during radiation therapy. If we are to do IV vitamin C, it can again improve fatigue and quality of life. And it's not going to interfere with your radiation or your chemotherapy. And one thing I did forget to mention is the recommended dosing. Like how often, that kind of thing, should you be going for an IV vitamin C? So the research shows that, and again, this research is done in people who are actively in cancer treatment. So the research shows that if you go 2 to 3 times per week for 6 to 8 weeks, that typically gives you the outcome that you're searching for in terms of the quality of life, and again in terms of length of life in the more aggressive types of cancers that have been studied with the IV vitamin C. It's a lot. And again, like it depends on where you're at and how much we want to dive into things when it comes to improving your quality of life or potentially tackling cancer cells, especially if you're in treatment. But if you are post-treatment and you're like, I don't really want to go 2 to 3 times per week for 6 to 8 weeks, like that's a lot of time. Each drip is usually 60 to 120 minutes as well. Can be also pretty expensive depending on where you live and what clinics you go to. And it's just a lot of time, energy, effort to go 2 to 3 times per week for 6 to 8 weeks. But I would like to have some of the anti-cancer impacts. I would say that, and I would love my colleagues, if anyone's listening, to chime in on this. And I'm like other colleagues, I know I've chatted with many that are close to me, but anyone else listening in who might do these IVs, we find a lot of people will go maybe once a week if they're in treatment or once every 2 weeks if they're in treatment and still see some benefits from that as well. So we just have to space it out with what's manageable for you and just kind of monitor, are you actually seeing an impact or not? And then if you're post treatment and you're like, well, could this still be beneficial? If so, how often should I go? What we typically recommend is if someone's kind of just post-treatment, let's say they finished last week or last month, then maybe we might recommend they go for an IV vitamin C maybe every second week to start, or at least once a month for a couple of months, see how they do. And then we can space that out more or just stop. Again, it's all based on you and what's manageable and kind of putting all the pieces together to find out what's going to work, what's not going to work. And we still see benefit in terms of people healing a little bit faster. There might be an additional kind of cushion of some cancer killing impacts if the mechanism of action is to induce this hydrogen peroxide in cells to kill cancer cells. Then if there are any cancer cells still kind of hanging out there post treatment, maybe it can go and tackle some of those. We don't really know for sure. And then some other instances where we might recommend it post treatment is, let's say someone's doing their ctDNA testing, which is a blood test looking for circulating tumor DNA. And we have no affiliation. This is just the company we're most familiar with. But if you want to check out ctDNA testing, you can look at Signatera. But the current thing is that ctDNA testing is kind of so new that people don't know what to do. Like doctors don't know what to do if their patients come back with a positive ctDNA test, but all their scans show that nothing is there. So if we are typically having clients do their ctDNA and potentially they come back with a positive ctDNA test, so they have some incident or some indication that there's some cancer cells potentially on their ctDNA test, but their scans were all clear. The doctors are like, we're not going to treat based on that as because we don't have any protocols yet to show is it actually going to benefit someone to treat based on ctDNA and negative scans. But to us, we're like, well, we're going to try some high dose vitamin C then, or maybe some mistletoe, which I'll get into in another episode. But we're going to try the high dose vitamin C and let's try, if we can, twice a week for 6 to 8 weeks to see if we can retest your ctDNA down the road in 4 to 8 weeks and see, do we notice the numbers going back to normal? Now, just one quick thing is that if you do your testing, like your blood work and things like that, too close to just having your IV, like your vitamin C IV, it might throw off your markers. So if you are doing any blood work whatsoever, we prefer to give it at least 24, if not 48 hours before you have any blood drawn because it can mess with your markers. Am I getting into that next? I might get into that in just a second, but I want to finish my thought process here. So basically, what happens is we recommend IV vitamin C depending on you. So the aggressiveness of the diagnosis, how far post treatment are you? Do you have any side effects that we want to work on as well, like immune function? Like maybe your immune system's depleted, maybe you're fatigued, maybe you're having trouble healing, maybe IV vitamin C might be a better option for you. Or potentially if you had a ctDNA that came back positive, but your scans were negative, we don't know, like the doctors don't know what to do with you. So we're going to try to do a little bit more of the anti-cancer, cancer killing, harder hitting IV vitamin C stuff. Okay. Let's see what else. Yeah, let's now talk about the labs that I was kind of getting into. I just don't want to jump ahead too far, but let's now talk about it. So IV vitamin C is incredibly safe. It doesn't really interfere with your chemotherapy or radiation. Again, case by case basis to absolutely make sure that it's not going to interfere with it. But it's safe because people need to do proper workups beforehand to make sure that it is safe for you. So we want to always do a what's called a G6PD, a glucose 6 phosphate dehydrogenase, I think it stands for. I cannot remember, but I'm pretty sure that's what it is. So G6PD blood test. We also want to do kidney function test and electrolytes. So G6PD tells us if so let's say your G6PD comes back and it says that it's low or deficient. That means that you would have been at risk for what's called hemolysis or the breakdown of your red blood cells if you were to receive higher doses. So let's say 20 grams and above of vitamin C. So basically, if you didn't have this test done, the G6PD test done before you went in for your high dose vitamin C treatment, you would have been at risk for a lot of damage to your body. Your red blood cells would have been damaged, potentially leading to kidney damage, things like that. So I would never do an IV vitamin C, a high dose, without running someone's G6PD first. If you're doing more low dose, like what they do in the IV bars, IV spas, whatever they're called, then it's most likely to be safe. But the higher doses, your body just won't be able to handle that high dose of vitamin C appropriately, which would lead to your red blood cells lysing. So I used to work in a lab, used to own clinics. I've run so many IVs, and I would never ever do a G6 or do an IV vitamin C without running someone's G6PD first because the risk is there. Although it's very small, like not a lot of the population has the G6PD deficiency. I've still run across it in my lifetime. And I haven't run IVs in about 4 years now because we work online. We support women worldwide now virtually. And typically we will refer people out to clinics to get their IVs done so we don't have to do them ourselves because no one's figured out how to beam us up into your homes just yet. Um, but whenever I was working in those clinics, we do G6PD. I do know there are some clinicians who are comfortable starting at low doses and slowly ramping up into higher doses over time without running a G6PD. But to me, the test is cheap. It's not that hard to get done anymore. It used to be kind of harder to get done. So just run the darn test, and then we don't have to worry about the risk of giving someone an IV, then all of a sudden there's bleeding problems, basically. So we want to do the G6PD. We want to do your kidney function, and we want to do your electrolytes. The reason being is that these bags there's a lot of fluid going in a IV vitamin C bag. That's why it takes 60 to 120 minutes to deliver, is because we don't want to overflow your systems too quickly. We want to let the water drip in nice and slowly. And the kidneys can become overwhelmed if there's any kidney damage, then it can't handle the IV, or sorry, it can't handle the vitamin C. And also the fluids within the IV might not be able to be properly pushed through your kidneys too if you have kidney damage. So make sure your kidney function is good. And electrolytes, your potassium, magnesium, those kind of things, like we want to make sure that those are balanced because your body uses calcium, magnesium, potassium in order to put things in and out of your cells. So if your electrolytes are really wonky, then we probably won't want to do an IV vitamin C bag because it might make it worse and just kind of lead to, whether it's like metabolic conditions or kidney problems or anything like that, just some damage to your body. So we want to make sure that looks good on blood work. Super simple and not very expensive blood work to have done. What else do I want to say about that? Oh, yes. Um, so we had this client once, and she was working with a functional practitioner locally in a clinic. And she had already been seeing them before coming to work with us, and she was seeing them for IV vitamin C bags. And I think they might have been doing some nutrition or whatever. It just wasn't comprehensive enough. So she brought us into her team as well. And we sent her with a list of blood work to have done through this practitioner and that she was seeing, and they did them for us, and we got the results back, and we're like, holy crap, what's going on here? All of her numbers were wonky. I think it was like definitely her glucose was high. I think her insulin was high. Her electrolytes were all weird. Um, I think even her white blood cell counts were wonky as well. And we're like, oh my gosh, like she was generally fairly healthy. She was post-treatment. She was working on recurrence prevention. And she had no major health conditions or anything like that. Like she was doing well. We were just kind of fine-tuning everything that she was working on and investigating further. So what's up with this blood work? Why is it all wonky? And the reason was that this practitioner, or whoever was working with this practitioner, had drawn her blood midway or after, I cannot remember which, her IV vitamin C. And it threw off all of her markers because here's what happens is that the vitamin C molecule looks very much like a glucose molecule. So it is going to artificially raise your glucose, for example. So it's going to make your glucose markers, your blood sugar markers, look higher than they are. So I got to take a sip of my tea. So her glucose markers were high, her blood counts were all off, everything was all off because her body was processing the vitamin C IV. So we definitely want to make sure that you're getting your blood drawn before getting your IV done, or at least 24 hours, preferably 48 hours after getting your high dose vitamin C done, because it's going to make your labs more accurate. So I hope that was a story to learn from, that we want to make sure that your practitioners are very knowledgeable in blood labs and vitamin drips. And you probably don't want to go to an IV bar to get your high dose vitamin C done, which is, I don't think, where she went, but just another kind of word of caution. You want to get your proper workup done to make sure that it's actually safe for you and your body. And we also, one thing I did mention, but we also want to make sure that the IV vitamin C bag, also includes magnesium, potassium, and calcium. They help a little bit extra with protecting the kidneys, and they help to reduce the nausea that might happen with sometimes when people get the IV vitamin C, they might experience a little bit of nausea. That might be more for your practitioner to know, but you can just kind of quickly ask, hey, did you put magnesium, potassium, calcium in this bag as well? If not, do you have that available to kind of put in adequate amounts next time, potentially? because it can, again, help with your kidney protection and reduce your risk of getting nausea from the therapy. So overall, pretty much the IV vitamin C is extremely safe. You just have to make sure you're getting a proper workup and that it's individually safe for your body. It is not going to interfere with the majority of chemotherapies. It is not going to interfere with radiation. We really need to make these decisions based on a person by person basis to make sure that it's going to suit you and not just kind of everyone say, no, it's not safe. You can't take it. Because there's research showing that it is safe. So let's make sure that we're giving everyone individualized care. And just other considerations are that the side effects from the IV vitamin C are generally very minimal. Again, if you're being well screened and that your body is set up right to be able to handle the vitamin C IV. But typically we just see vein irritation, and that could be adjusted based on you can just kind of slow down how fast you're getting the drip or change what's in the bag a little bit, like adjust the amount of vitamin C or the magnesium, potassium, things like that in the bag. Some people will experience mild nausea, but we would typically kind of just advise our clients to come in after having eaten something or to bring some food with them or to provide snacks, which really gets rid of that nausea quite quickly, quite easily if people just don't come in and get an IV vitamin C bag on an empty stomach. Sometimes we see people might be a little bit tired after getting their bag because their body has been working hard to use the vitamin C and to push things around, get things through the kidneys, get things in and out of the cells where they need to be. So it just requires energy from your body. And that's pretty much it. We might see some changes on blood work, but again, I prefer to see people get their blood work done about 2 days after their IV if possible. So overall, we do find IV vitamin C can be very beneficial for the right person. I don't think everyone should be doing it, and I don't think no one should be doing it. We got to figure out what's best for you. Most of the research is done on people who are currently in chemotherapy or radiation and the impacts of vitamin C and quality of life. We need more research on recurrence prevention. I would love to see that happen, but I think it's being done. I'm not 100% sure, but I think it's being done. And mostly we see that it is completely safe, very minimal side effects, and you just have to make sure that you're being properly taken care of by your practitioner who is giving you the IV vitamin C. So I just have one little thing to let you know about. I do have a bit of a gift available if you haven't received it already. I have 2 meal plans that you can go and download. I have one vegetarian-based meal plan. I have one omnivore, so meat and veggies-based meal plan. All you have to do is leave me a review on wherever you listen to your podcast, whether it's Spotify or Apple Podcasts, things like that. Just leave me a review. Take a screenshot of that review and then send me a DM on Instagram at Megan Bernard ND with the word 5 stars. So don't just send me 5 emojis, even though it's beautiful and I love it. Make sure that you type out 5 stars or the number 5 and then the word stars, because then I will send you an automated message basically with the 2 meal plans for you to download right away as in thank you for your review. If you're watching on YouTube, you can kind of do the same thing. Just leave me a nice review, subscribe, and take a screenshot of your comment or whatever it might be. Send me that picture, that screenshot at Megan Bernard ND in my DMs with the word 5 stars. And again, you'll get sent the meal plans as well. Why do I do this? 1, meal plans are kind of fun to make, and I think people really enjoy getting them. And 2, this actually helps me to reach a few more people who are needing this information when it comes to how the heck do you feel better post-treatment and what actually is going to make the difference when it comes to keeping cancer from coming back. So these reviews, they do a bunch of like algorithm things and they help to reach more people. So that's what my big goal is to reach more people to support and to teach and educate. So I appreciate that very much. Thank you as well for tuning in, and here's to flourishing after cancer. Thank you so much for joining me today on the Flourish After Cancer podcast. If you loved this episode, please be sure to leave a review and subscribe so you never miss an episode. Sending all my best your way, Dr. Megan.